Hey, welcome to Roads to Forever. I'm Terry, and in today's video, I'm going to be talking about the best medicines for stomach ulcers. And I know in the past, most of my video have been about how I treated my stomach ulcer naturally. And if you haven't seen those videos, don't worry, I've linked them in the description box down below so you can check out those videos after you're done watching this one. But I'm doing this video on stomach ulcer medicines because there's individuals who say, well, I don't want to go the natural route. I would like the doctor or my healthcare provider to prescribe something that I can take right away that will ease the pain and will give me stomach ulcer relief now, right? And so this is why I am doing this particular video to talk about the course of action that you might expect based on if your doctor has decided, that you've had a stomach ulcer that's been induced by your use of non-steroidal anti-inflammatory drugs. So, there's going to obviously be a different course of action if your stomach ulcer is caused by the H. pylori bacteria. But in this video, what I'm really going to focus on is overuse of non-steroidal anti-inflammatory drugs and what are the possible treatment plans that your doctor might prescribe. So obviously, one of the first things they may say to you is to stop your use of non-steroidal anti-inflammatory drugs. And so before you decide right now watching this video, you're just going to stop taking your non-steroidal anti-inflammatory drug, I want to say, no, don't do that. Make sure that you have a conversation with your healthcare provider first so they can tell you if this is really the best course of action for you. So like I said, that might be one of the first things they may suggest. The next thing they may actually suggest is to reduce your use of non-steroidal anti-inflammatory drugs. So maybe if you were taking, four, non-steroidal anti-inflammatory medications. So, when I talk about non-steroidal anti-inflammatory drugs, I'm talking about things like Motrin, ibuprofen, naproxen. Those are some examples. So for instance, if you were taking maybe 800 milligrams of Motrin a day, they may say, all right, well, let's try to see if we can reduce that to 1 or 2, 800 milligrams of Motrin for the day. But again, that's something you would decide with your doctor. The third thing your healthcare provider might suggest is that, maybe they're going to switch you from a non-steroidal anti-inflammatory to a different medication regimen because, I don't know what condition you may be dealing with that you decided to use non-steroidal anti-inflammatory drugs. And so your doctor might switch you to a different category of medications that will help you to deal with whatever issue it was that you were taking non-steroidal anti-inflammatory drugs for. Now, we've talked about the removing and reducing and maybe even switching with your non-steroidal anti-inflammatory drugs, but now let's talk about how we're going to treat the ulcer. And so in terms of how your ulcer is going to be treated, there are a few things your doctor or your healthcare provider might do. And so they're going to definitely look at how they can, reduce your stomach acid, how they can protect your stomach lining, and how they can also coat the stomach lining. And so first, let's talk about, one possible type of drugs your doctor may use, and that's what's known as proton pump inhibitors. And with proton pump inhibitors, their job is really to reduce your stomach acid and to also protect the lining of your stomach. And some examples of the proton pump inhibitors that your doctor may prescribe are things like Nexium, Prilosec, and Protonix. And so I'm sure you've seen those commercials at home, right, for Nexium and Prilosec all the time. Protonix is another drug, like I said, that they may prescribe. And there are several other proton pump inhibitors that are available that your doctor may prescribe. But again, they're going to look at your own health history and make a decision from there. The next type of medications your doctor may prescribe are things known as histamine receptor blockers. And so in your body, histamine is a chemical and its job is really to signal your stomach to produce acid. And so in this situation, when you have a stomach ulcer, obviously you want to reduce the amount of acid that's being produced. And so that's why your doctor may prescribe a histamine receptor blocker. And some examples of histamine receptor blockers that your doctor may prescribe are things such as Tagamet, known as cimetidine, or they may prescribe famotidine. And then in the past, one that was really popular that doctors used to prescribe was Zantac, right? And so as of April 1st, 2020, the USDA has removed Zantac from the market because they have determined that Zantac is a probable human carcinogen. So if you are still taking Zantac and you did not see the USDA statement on Zantac, this is what the USDA had to say about Zantac. The FDA is committed to ensuring that the medicines Americans take are safe and effective. We make every effort to investigate potential health risk and provide our recommendations to the public based on the best available science. We didn't observe unacceptable levels of NDMA in many of the samples that we tested. However, since we don't know how or for how long the product might have been stored, we decided that it should not be available to consumers and patients unless its quality can be assured, said Janet Woodcock, director of the FDA Center for Drug Evaluation and Research. The FDA will continue our efforts to ensure impurities in other drugs do not exceed acceptable limits so that patients can continue taking medicines without concern. So make sure that if you have Zantac in your house or, for some reason you have some laying around, that this is something that maybe you want to get rid of, obviously. Now, in terms of what the doctor will prescribe to coat your stomach and to help heal your ulcer, it's something known as Carafate. And so again, its job really is to protect your stomach lining and just kind of serve as a coating so that way your ulcer has time to heal. So those are all of the different types of medications or treatment regimens you can expect with a non-steroidal anti-inflammatory induced peptic ulcer. And again, everyone's treatment plan is different. So you always want to make sure that you are consulting with your healthcare provider so they can figure out what is best for you. Now, if you enjoy this type of content, I ask that you give it a thumbs up, share with your friends, and subscribe for more awesome content just like this. Before you leave, I want to remind you, you're only one prayer away. Thank you so much for watching, and I'll see you in the next one. Bye. Take care.